There we go. We're good. All right. And so I'm now going to turn it over to our illustrious leader, Kendra Kopanis, who's the executive director of Generate Health. And she's going to share information about the actual business part of this meeting for our members.
Good morning, friends. How are you? How are you? I've got my words just flowing today. So smooth. Anyway, it's good to see everybody. It's good to be together. Our team was reminiscing yesterday about what it used to be like when we were in person at these meetings. And while all the setup and getting there early wasn't always our, best part, we do miss seeing you all in person and connecting. So we're happy to be here and connected in this way, at least. September is when we hold our annual meeting, and that's important because as a coalition, we're a membership organization, and our members have some important business. And so we share that with everybody when we come together in September. First, I want to put a little plug in for an upcoming event, and that is our annual awards event, which is the Standing Up for Black Mothers and Babies Awards celebration. And that will be held October 21st at 7 p.m. virtually. We gather one time a year to present awards and to kind of really re-energize around this mission that we collectively are working towards. This year, our guest speaker will be Mayor Tishaura Jones to sort of really rally us to what our opportunities are right now to advance policy that's good for Black moms and babies. We also have 4 amazing honorees, one of which is here today. We're excited to be able to recognize Ebony Hooper Boateng, who is an amazing doula. She will be receiving the Judy Wilson Griffin Maternal Health Equity Champion Award. So come join our event and celebrate Ebony, celebrate Elevate Women Collaborative, Jessie Davis, and Village of Moms. So some amazing people and groups that we want to uplift and share their amazing work. We also have a lot of fun during the event, even though we're virtual, and we will have a pretty special announcement of some great opportunities to get involved and support this mission and help us work sustain towards our vision of zero race disparities by 2033. So join us. You can get information and get your tickets on our website. So our business today, so members, we're a coalition, so we have members, and members are individuals and organizations that they pay dues and they commit to supporting this organization, this coalition, to be a strong collective voice. And they have an important role. They elect our board and officers, and they adopt and approve our policy agenda. And so each year in September, we put forward a ballot with board members and the policy agenda. So for members, you would have received your ballot by email in advance, and you'll be voting by email or fax of your ballot. So we aren't taking live votes during the meeting, but just like to share with everyone what's before our members for election. We have a number of individuals on our board who are up for re-election for new terms, and we are, the commitment and dedication that they've been showing to serve Generate Health is noted and really appreciated. And we also have 3 new directors put forward to our members for election. We have room for all 3 of those to be elected, and our governance committee is really excited to put forward Dr. Carolyn Pryor. She's a medical director at SSM Health, St. Louis Maternal Services, medical director. She is an OB with a long history of practice in North County and serves a lot of roles within SSM. And she's filling an important role for our board to have an obstetrician gynecologist on our board. We're also excited to put forward Akila Wicker. Akila is Director of Human Resources for the Central States area of Charter Communications. She has been on our HR committee for a number of years and now is going to kind of accept this nomination to step onto the board. And then we also have put forward Sean Dryden. He is a healthcare leader with SSM. He's the Vice President of Ambulatory Services at Cardinal Glennon. And we're excited to welcome him, or invite you to consider electing him to bring his strategy and operational skill set to our board. We also have one officer to put forward, and that's a vice chair. And we are excited to nominate Angela Brown, the CEO of St. Louis Regional Health Commission, who has been a member of our board and executive committee for a few years, and look forward to her succeeding our current board chair in 2023. So our current board chair is Angeline Peters-Lewis, and Angela will, as vice chair, follow in Angeline's footsteps. So that is our governance report and what's on the ballot for that. I will say that advocacy agenda is also part of the ballot that members received. And to talk about that and give you a brief overview of the advocacy agenda that was put forward, I'm going to turn it to Laura. And before I do that, real quick, I've seen a lot of chatting, and I just want to make sure if there were any questions, if the team will let me know if there's anything I need to address. Okay, Laura. Okay, great. So welcome everyone, and I'm going to turn it to Laura, who's going to go over the advocacy agenda and then move us into the next part of the agenda. So, thank you.
Thank you. Good morning, Generate Health family and partners. So I have the pleasure of kind of introducing you to the 2022 advocacy agenda. So if 2022 is anything like the past two legislative sessions, advancing such an ambitious agenda will be a heavy lift, and it'll take all of our collective efforts and powers. Members should have received the ballot, as Kendra mentioned, ahead of time, so ahead of today's meeting, to make your selection of both the board slate and this advocacy agenda. So this is an exciting time. So thinking about 2020 and 2021, this was a year of two pandemics, both fighting COVID and racism. Wow. Generate Health focuses on policies and legislation that eliminates racial disparities and infant mortality and maternal health. And each year we establish the policy priorities based on our community and partner feedback and analysis of the policy landscape. So we participate in advocacy efforts, as you all probably know, in multiple ways. If we're driving advocacy, we're doing that by leading advocacy efforts, determining strategy, and bringing folks together around key maternal child health issues. If we're supporting advocacy, that means simply participating in other strategies. We're at your table, you're at our table, and bringing our community voice to that process. Third, if we're monitoring issues, we're tracking, we're testifying for and against issues, and if need be, bumping up and moving up in action. So with no further ado, the 2022 policy priorities are basically categorized into four major pillars. They include the first pillar, promoting racial equity in social and economic factors that affect communities. This is improved economic conditions, like increasing the minimum wage or paid family leave, reliable transportation, safe and affordable housing. This is a big chunk here. So affordable, high quality childcare, access to affordable and nutritious food, and equitable expedited responses to the impacts of COVID. Now, when you think about this, all of these areas were exacerbated during COVID, during this pandemic, and exposed great disparities in our community. Lots of work to go in those areas. And the second pillar, promoting racial equity in maternal health and decrease maternal mortality. This simply involves improving access to affordable and equitable women's health care before, during, between, and after pregnancy. This encompassed including the 12-month postpartum coverage, which we're fighting for. It also involves promoting women's reproductive health and preventative care, promoting behavioral health treatment for substance use, mental health, and perinatal mood and anxiety disorders, promoting trauma-informed services through home visiting, community health workers, and doulas. The third pillar, promoting racial equity in infant health and decreasing infant mortality, improving access to affordable and equitable health care, and promoting safe sleep practices and infrastructure capacity, and in promoting trauma-informed services through home visitation, community health workers, and doulas, just like the previous pillar. And the fourth and last pillar is promoting access to equitable health care. So developing provider capacity to decrease implicit bias and racism, building trust through trauma-informed awareness and cultural humility, and faster, easier Medicaid enrollment for those who qualify, and working to restore lost coverage. As a quick sidebar and a shameless plug for the launch of the Medicaid Expansion Helpline, this will be ready October 4th. It is a 7-month project led by the Regional Health Commission that will help answer questions regarding the Medicaid expansion for people living in St. Louis City and County. I want to say we're going to put a win in that, a mark in the win column when it comes to Medicaid expansion. We had to fight for it, but we got it. So with that, I will just pause and ask our team, what is the, I'm just asking Kendra real quick, what is the deadline for our members voting on the slate?
Yes, today. So by end of day, we need to have your ballots, and certainly reach out to me or Laura offline if you have any questions that you'd like to discuss. So, but yeah, end of day today.
Thank you very much, Kendra. So I am going to move us into the next half of our kind of the meat of our time together. And before I do that, I just want to, I think I'm gonna say you have a special treat in store for you. We have some things that we want to unveil and share with you. But before we do, I do want to take just a quick moment to recognize several of our elected officials that have joined us. We have Senator Carla May with us on the call. I think I saw Senator May. We also, I believe, have Representative Alan Gray. I don't see Alan in one of my squares, but it doesn't mean he's not on the call. And then Representative Marlon Anderson. I just want to take a quick moment, if you are on the call, just to recognize you, and just if you can unmute and just say hello.
Well, I thank you for the invitation, and I'm excited about listening to what your goals are and your advocacy plans for this coming up session. So I am just here to listen and take notes. And if you have any questions or anything you need from me, please feel free to contact my office. I put my email in the chat box, so it's better to send an email. That way we can reply and we can get a detail of what you're asking the office. So I appreciate the invitation. Thank you.
Awesome. Any others on the call? Well, thank you, Senator May, for blessing us today. And we are going to move into the meat of our meeting. I'd just like to ask you just a quick question. I'd like you to post in the chat one word that best describes how you feel about advocacy. One word that best describes how you feel about advocacy. Then I am going to share my screen as we do that. We have everybody. I see some interesting words here. All right. Excellent. And thank you for sharing. So I'm going to share with you kind of how we're going to spend our time, the remainder of our time together. We will review some of the key policies and bills from 2021. We'll kind of introduce you to several of Generate Health's new advocacy tools, both our legislative report card and our advocacy guide toolkit. We will introduce you to one of the strategies that you can use for around advocacy storytelling. And then we'll do a brief breakout where you get an opportunity to craft a story and make a pitch. We have Senator May on the call who can give us some direct feedback, and then we'll close things out. So that is the way we will spend our time together. And then we can get on with the rest of our Thursday. I have to, in fact, remind myself, what day of the week is it? But it is Thursday. All right. So just giving you some of the major themes of the policies that we tracked this year really fell into 6 tracked areas. Infant and maternal health encompasses contraceptive and reproductive health services, postpartum Medicaid coverage. We still got work to do in these areas, we know. Another bucket was the health and mental health, the federal reimbursement for Medicaid, which, was went into a special session. And it also included getting contraception covered and included in that package. Racial equity, we were elevating cultural competency training for health care workers, housing, which was a huge area in the era of COVID, with some landlord tenant actions and some utility protection for tenants. And then food security, certainly felt some attacks in that arena, where we also got some wins around getting produce for WIC recipients and tax credits for grocery stores and food deserts and the like. And then the safety net. So this involved our advocacy efforts around paid family leave and child development accounts, which certainly have more work to do, but we're close. So it is apparent to us that many legislators aren't aware of the issues affecting Black moms and babies. And it signals to us that more action and awareness building is needed. So we are excited to see some of a mostly clean FRA, which was the Federal Reimbursement Allowance bill that passed during the special session. And that was, among other funding, extends Medicaid coverage for contraceptive services. And we also have a notable, I'm going to say a potential win next time around, the Show Me Healthy Babies bill that was sponsored by Representative Bosley, aimed to extend Medicaid coverage for moms in the program to 1 year postpartum. It got added as an amendment to a bill, and unfortunately that bill didn't pass, but there was potential for bipartisan support. So you got to take your wins where you get them. And then we also were glad that some bad bills didn't pass, including work requirements for SNAP benefit recipients and various versions of that FRA bill. So we had good other good bills that passed through committee, making it more promising that there's potential to get that legislation passed and signed into law in the future. And the same with bad bills. There were some that passed through committee that we know we're going to have to continue to advocate against. So as some of you may remember, maybe it was a year, I almost lose track of time, but Generate Health developed impact reports. I want to say it was about a year and a half, 2 years ago. And we received feedback from those and have been busy really listening to that feedback and making those adjustments, and have developed some new advocacy tools, mainly to support you in your advocacy role, in advocating for the things that you see are most important to you. And so I want to just take a quick moment to shout out several of our interns, Ashley Bird and Colleen Madden, who are on the call and will be sharing a little bit of the information about the new tools. But they did a fabulous job, and I just want to take a moment to recognize their efforts and just send some positive vibes their way. Thanks so much. So with that, I am going to turn it over to Ashley, who will give you a little background of our legislative report card. And I'm actually going to drop in the chat, or I'm gonna ask my team member to drop in the chat. It's a little challenging for me, but if you can drop in the chat, it is posted on our website. It is live today. So you can access both these tools as we roll them out. Ashley?
Good morning, everyone. So it was, as Laura had already mentioned, Colleen and I worked together on both of these projects, or on the projects over the summer. So as we go through to discuss it, I may be leaning on her for some of the technical things as well. So we selected the previously mentioned policy areas because we felt that it was important in order to develop the criteria. And so the bills that we selected targeted each one of those policy areas. And Colleen, there were about how many bills?
We tracked well over 100 throughout the session. I think that about 60 were included in our final scoring.
Correct. So we also, so I was very much involved with the presentation, the communication side of the project. And Colleen did a lot more. If you look, you saw that I'm the social work, social policy person, and Colleen's a lot more the public health person. So Colleen did a lot more of the aggregating the data in order to process it. And I did a lot more of the technical, how to communicate it. And so when you look at the way that we have the presentation set up, do we have the slide for? There we go. So sorry, I was just like, wait a minute, we're still stuck on that slide. So we have these three categories. We have the champions, inconsistent supporters, and non-supporters. So our champions are those who consistently voted in favor or sponsored bills that affirmed and provided better environments and networks and lifestyles for Black and mothers and birthing persons. And oftentimes we attributed even maybe a bonus point based on how they voted along the way. Our inconsistent supporters were those who possibly did not always vote in favor of this demographic, but were not opposed to this demographic. And then our non-supporters were those who maybe did not vote in favor or sponsor bills that supported Black maternal and birthing persons or their families in ways that were equitable or advanced their living situations in order to create equity later on and safer environments. So as you can see here, we have the list of senators on this page. And you can see the fact that all the people highlighted at the top in the green are our champions. These individuals made a point throughout their tenure and throughout their record to support individuals who are Black maternal and birthing persons. And they have also, so we also have the non-supporters who have, for whatever reason, not been as supportive. And you can find the legislative report card at the scoring methodology. So you can find the full report and scoring methodology on the website if you would like to. And at this time, I'm going to officially pass it over to Colleen.
Hi, good morning. So happy to be back with Generate Health. I spent such a good summer working with the team, and it's nice to be back and share this work that we spent so many hours on. We hope that it's useful for all of you and for our community. So as Ashley and Laura have both mentioned, last year we had the impact reports, and then this year we have kind of refined that into a legislative report card. A lot of the feedback that we got from our community told us that this information is great, but a lot of folks don't know what to do with it. And I'll be honest that before I joined Generate Health, I was pretty foreign to the policy and advocacy space. So this was a great opportunity for me to kind of use that lens of uncertainty as far as developing a toolkit that other folks then can use to advocate for issues that are important to them. So we have this toolkit that you'll also find on the website with the legislative report card. Maybe next slide. Okay, so in the toolkit or the advocacy guide, we've been using both of those phrases, but it's just this one document. And there's 7 key tips that we have in that guide to help our community members and all of you as our partners to advocate for really anything that's important to you, or advocate against policies that are kind of deterring your mission. But we're of course focused on the maternal and child health space, but this could be for anything. So our 7 kind of key buckets are to contact a news outlet, door-to-door campaigns, policymakers, attending events, storytelling, signing petitions, and then using social media. And we do want to point out that just being here today, you're already hitting 3 of these. So you're at an event, and we're going to do storytelling and talk to policymakers.
Awesome, thank you. So I'm sorry, I wasn't able to see if someone posted in the chat where folks can find that tool, those tools. Hope that happens. Great, awesome. So, you know, one of the things that keeps coming up over and over again, and I think Colleen elevated this, is, you know, how do you actually do it? So it's not a mystery, but there's a level of discomfort many times and a disconnect. And I'm really hoping, Senator May, you can shed light on some ways that to make it more accessible and make it, you know, demystify it. But this is just one tool that we're just pulling from the guide to walk us through and practice a little bit. One of the things that we hear often is my voice doesn't matter. Why should I share? How is sharing my story going to make a difference? And so we want to just share an opportunity to kind of walk through some of the things of why telling your story can help both spread awareness, it can spark change. Nobody knows your story better than you, and that this can really improve circumstances for a collective community. And so that's what we want to elevate. And then how, as organizations, you may be able to collect those stories or to utilize those stories to amplify your mission and the work that you're doing. So with that, I'm just going to walk you through a quick model of storytelling. So there is the hook. This is what gets folks' attention. It introduces folks to the issue. You kind of lead with, you know, a personal fact or anecdote, or even a rhetorical question. Did you know? Were you aware? And usually includes a statement of why telling this story, your story, is important. And then there's the thesis. This is the state of why. Why does this exist? What is the issue? What are the effects of that issue? And then what factors or circumstances allow that issue to exist? And then the evidence. Telling your story, think of the why the issue is important to you. So what are your lived experiences? Are there experiences of your loved one or others in your community, others you work with? Consider what values you and the community have that make the issue important and urgent. And then the last is the ask. What you can't leave without, what do we want? This summarizes kind of and puts a bow on what you want, what you expect to happen to make things better. And so, and just a side note, like keeping it as short and limited to 3 minutes or less, because legislators are busy, they're pressed for time, and this is just one tool that we can use to help us, develop our own story. So I'm gonna pause for a quick second and just think about, what story do you have? What might be something that you share or you want to share with someone to make an impact? So I want to just start with a sample and walk us through a quick sample, and then we're going to spend time getting in our breakout groups, and then we'll practice one with our group. So the hook is really centered around advocating for paid family leave. And so my hook, to make sure all our moms and babies are healthy, all workers should be able to take paid family leave. My pregnancy would have been very different if I'd had access to paid time off. So my thesis, during the first months of my baby's life, it is crucial that me as a parent, that I can bond properly and care for my baby. This is crucial for their social, emotional development. Especially during the first 3 months, mothers like me need time for their bodies to heal. And although paid time off is necessary to support both of those factors, only 14% of Missourians have access to paid family leave. The evidence. So while I was pregnant, my job didn't have paid family leave. It didn't have a policy. In order to take 3 months off for my pregnancy, I had to save up my paid time off and sick days for 2 years. I had complications with my pregnancy, which caused me to have to use some of that time to attend those doctor's appointments to deal with those complications. And because of this, I only had paid time off to cover 3 weeks of pregnancy. In order to cover the costs of taking that additional time, I started taking on a driving job through Uber. I drove for Uber after work for a few hours each day until I saved enough money to cover the time off I planned to take after giving birth. Those 2 months were exhausting and my health suffered. Here's my ask. If my employer offered paid family leave, I would have had a much easier pregnancy. I would have been less stressed and had more time to enjoy the special time in my life. All women deserve a happy and healthy pregnancy. And I urge you to pass a paid family policy for all workers in Missouri. All right. That's the story. So what are we going to do? We're going to move into small breakout groups. And for the sake of time, each group will have a designated Generate Health staff to kind of help facilitate and support, and is assigned a kind of specific issue. So there are really issues that are centered around the topic areas or bucket areas that Generate Health elevated and advanced. So your group will collectively craft a story, ideally based on your lived experiences or someone that you are working with. And then we will come back together as a larger group, and hopefully we will have other elected officials. But if we don't, we have Senator May to give us some feedback on listening to those stories. So you'll have 15 minutes to craft your story, and I will give you a 5-minute warning. So Yes.
Excuse me, Laura. Senator May has put in the chat that she'd love to give some feedback now.
Thank you. Great, thanks. Senator May?
Yeah, good morning. I was listening to your story. So, and I'm assuming that you'll be talking to legislators as you converge on the Capitol, communicate these stories and getting support for your issues, right? I'm gonna give you this because I was an advocate before I was an elected official. And the reason I'm giving you this now is because I do have a 10 o'clock that I have to get on. So the key with legislators is, yes, everything at the Capitol is fluid. And so they're moving very quickly. But how do you pause them is to find out, what their demographics in their district is, and you always want to put in a what's in it for them in your story, what it will make them look like, what's in it for them. That's what they're going to hear. And when you're talking about these impacts, another a way too that you can help legislators get involved is you have to invite them to a real life situation. You get what I'm saying? Where they can visit, where they can see it in real time, because most of the time their districts or their communities are so far away from, what you're talking about that they can't relate. So sometimes you have to put it where they can relate to it, get it that way. And that helps them, with clarity and things like that. And one other thing is to also, remind us, because sometimes we're only thinking about the district that we have been elected in, but this charge is actually, we represent the entire state. It's 34 senators. We represent the entire state. Even though we divided into a 34-piece puzzle, we still collectively represent the entire state. And so we want to make sure that every part of the state is flourishing. And so, you want to make sure you put that in your story, when you're talking to legislators, and they just need reminding. Most of the people I work with, even my colleagues, sometimes we agree on issues, but we have different paths to getting to the solution to those issues. And I find that most of the people are human. We do have some hot button topics that that separate us nationally, but more than that, people would hard to believe that we vote more together than we do apart. So I would, I just wanted to offer those suggestions to you. And, if you want to send me stories or whatever and have me to tweak them, I can do that for you. I do apologize. I have a schedule today that doesn't end to 8:30 tonight. So I have something going on every hour, and I have to jump off here at 10 in order to drive, to the next event. So.
Yes, thank you so much for that feedback. And I just say ditto. Just want our audience, our participants, to weigh in on your feedback, because what you shared were nuggets that we all could use to help make what we're doing more impactful. So I really appreciate the what's in it for them and making it real. Connecting the legislator to real life situations. So those are just critical to making this the work that we're doing more effective. So we really do appreciate that feedback. And we will take you up on that, Senator, around getting feedback. So that is a great resource, and we want to utilize that. So with that, I do want to just ask if there are any kind of major points before we kind of break into our groups, because I do want you to have a moment to practice, to get into crafting a story, and we will give collective feedback. That's kind of how we are adapting this session to do, and taking the lessons that Senator May shared with us into account. So with that, I'm going to ask Sarah, who's kind of working behind the scenes, and we can get into our breakout groups. I hope you had wonderful time in your breakouts. Someone said, Alicia said her story is too big. Well, this is why this session is what it is, right? It's to practice, not to make it perfect. It is to practice. So we're just going, because we don't have an elected official on with us at this session. What we're going to do is we're going to give each other feedback. And we're going to do so by putting that in the chat. So I am going to call on group one, and as you all have someone to kind of share your story, I want the rest of the group to be listening for things. What was most meaningful? Were there things that stuck out to you that you feel really made the point? Or were there things that left you wanting more information? So we really want to give, folks some real positive feedback, and anything that you feel like, man, if they would have just included this, that would have been wonderful. So just in the spirit of feedback and I want to say a culture of learning, right? So I'm going to ask group one, who was Asia's group, I believe. Yes, Asia. Do you care to share with the group?
Yes, I will do my best, because we had the lovely senator in our group for a bit, and she was giving us some more wonderful advice about storytelling. And so that was kind of interwoven with the story. I will try to pull out the story bits as I am reading. So for our hook, taking the advice, what's in it for whoever we're talking to. Oh, I'm sorry. Let me start with, our group had implicit bias training for providers. Okay, so what's in it for them? Lack of prenatal care and risk of complications are costly. It's about $180 million in St. Louis alone. If these trainings are required, we can save the state millions. You always have the idea that this isn't happening in my community. And then here we would make it personal for whoever we're talking to. That's some of the advice. And across the demographic, most stories are the same. It's just different people. Everybody wants safe communities. Every voice is important. Some families haven't connected to services due to feeling judged or biased. Some parents don't seek out prenatal care because they think that they'll be judged or treated unfairly. It should be mandated that providers have to attend implicit bias trainings. Those trainings that are being provided should also include examples and then specific tools that they can use in their day-to-day practice. I think that about covers it.
Excellent, excellent. Thank you, Asia, for representing group one. And again, I'm gonna ask folks to put your feedback in the chat. You all talked about the impact of that implicit bias. That just kind of drove a picture in my mind of, what would happen if that, the impact of not having that in place. Were there any other thoughts for this group's story that we can share with them? Trying to mind the chat. The dollar amount was compelling. Thank you, Rose, for that. Michelle Woodhouse, hey, Michelle. Like the acknowledge that this happens everywhere in all counties. Great, good feedback. Anything else for this group? Success stories when implicit bias training is in place. That's yes, great, good feedback. All right, so let's move to group two, just for the sake of time. Group two was the Rose, Marisha, Colleen, and Theo show. So
and Alicia and Kirsten were in our group. I'd said Marisha because she has the notes, and so she can concisely share what we talked about from the notes.
All righty. Put you on the spot. Come on, Marisha.
She did put me on the spot. So we had a lot in our group, but we decided to focus on housing, safe and affordable housing. And we were really good with coming up with evidence. So a lot of people shared stories about personal experience, having difficulty accessing safe and affordable housing. And I think an important note that a person mentioned was that affordable housing isn't just about creating complexes or it's about allowing families to really have access to not just safe, but affordable housing. We did not finish all of ours. We made it through our hook and then our thesis, and then kind of got stuck. So in the chat, if you could all help us craft and ask around safe and affordable housing, that would be cool.
I didn't know I was going to do this, but Michelle Woodhouse, I'm putting you on the spot. She's like, what? You know, I know housing was like her baby and spent a lot of time in that space. When you think about the making an impactful kind of a hook or an ask around housing, what is there anything that comes to mind for you?
I mean, housing is the foundation of someone's life, right? Without housing, without adequate or affordable housing, nothing else in a person's life can thrive. It's very similar to food, right? They're basic needs. So that would be my hook, is just that, like, if we want people to thrive, everyone needs access to safe and affordable housing.
That's a strong hook, Michelle. Certainly got your, attention, because everybody can find themselves in that hook, right? Thank you for that. All right, group 3. This is the Ashley and Michelle. You were in that group too.
Hello, here I go again. So we came up with all 4 pieces. But we basically have no Missourians. So let me first also orient everyone to what our topic was. It was, there we go. Disallowing work requirements for SNAP and other safety net programs. And we came up with no Missourian should go hungry. And in there we would include using the statistic of urban and the rural, in order to make it more personable and like allowing for people to see in numbers what is going on. That would increase the impact of the message using the 1 out of 8 in numbers. What does this look like for the entire state for a reflective representation of the population? And so food insecurity. So for the next point, the thesis, food insecurity, that the individuals have to apply for exemption from the work, and what is the most impact on the state, and what is the cost, and would there be a cost savings if they got rid of the process. 80% of the people would qualify for an exemption form, saving money on spending to try and enforce work requirements as a work requirement and is expensive. So in trying to reduce that cost, essentially the cost is being increased for the state with little cost benefit. Would be favorable to constituents. So another benefit in there is the fact that for representatives, congresspersons, and senators, it would be beneficial to the constituents in order for the program to be altered or removed. Would impact every area and what the data would say about that information. And so we looked a lot about the numbers and the costs and demonstrating through concrete information. And a need, so the next point is a need and or increased need over the past 18 months, and more people are relying on food banks and food pantries. The story could include something about how this is a big inconvenience for someone who has to get an exemption, and the logistics to have to complete the form, especially when lacking technology. For example, if you lack access to a computer within your home, and you have to go to another office or another space in order to complete the paperwork, what does that require you to do to have to get there? What's your transportation? How many modes of transportation are you taking to arrive at that destination? How stressful is that to you? And how much of a burden, an undue burden and cumbersome is it?
So Ashley, I'm gonna ask, what's the ask so that we can wrap and get to the last 2 before we time?
So remove the requirement for exemption to alleviate the undue burden on the people who really need SNAP benefits, the majority of whom do qualify for the benefits.
So the ask is clear, like we're asking to remove something so that they know specifically, and they have the power and ability to do that, right?
Yes.
And please provide that additional feedback, you all, to I guess that was group number 3's story. Thank you, Ashley. Thank you very much. And then the next group was Laura, Elizabeth, Leah, and Malia.
I have the notes, so I will just share quickly. Our group had really great conversation around creating greater access to doula care and reimbursement for families on Medicaid. And I think we have probably enough content to have a couple of different stories and different asks. But Ebony and Trish were also in our group and shared some really insightful information to craft a story. Ebony started off by sharing that there's often this perception that having a doula is a luxury, but really it's a necessity. And I think folks may have seen in the chat that Laura had shared, Ebony also shared that Missouri women who have Medicaid are 5 times more likely to die within a year of pregnancy than those who have private insurance. We talked about some of the personal experiences of how scary our American healthcare system can be. And for those who have doulas, it makes the experience of giving birth less scary. We then talked a bit about some of what we know about outcomes when someone gives birth and has a doula there at their side, that people who use a doula are 4 times less likely to give birth to an infant that's low birth weight and 2 times less likely to experience birth complications. They're more likely to initiate breastfeeding and less likely to develop postpartum depression. Our ask was really a twofold ask. First, it was for legislators to get more informed, learn about how other states are already reimbursing for doula care and doula services, and then also get more information about how doula care impacts not just that birthing person and their infant, but really the whole family and the entire community. And then our other ask was to put forth a bill that reimburses for doula services for beneficiaries of Medicaid.
Yes. Y'all just put it out there, right? You ask for what you want. And thank you for that. Those were very impactful. I love the scary and the luxury. I mean, all of those are key words that resonated. And our last group to wrap things up, that's Amanda.
Yay, so I was in a group with another Amanda, Carrie, Rachel, and Michelle. Carrie, did you want to share the story? You volunteered at the very end.
Yes, that would be great. So
in the chat.
Our group is paid family leave, which how do we follow that up from Laura Goley before we left for, she did all of the ask and such a great story. But a different side to the ask that we have is we had a story of I had to deliver my baby via C-section at 36 weeks. And during the time I was covered by Medicaid in Illinois, I did not have paid family leave or any type of leave at my place of employment. Bills and expenses kept going in, so I had to return to work 2 weeks after a major surgery. That's the hook, I think. Yeah. I had to put myself in danger because I did not have paid family leave. I did not have a chance to heal properly and bond with my child. I developed an infection due to this, and because I was on state-sponsored medical care for my aftercare, it had happened to be prolonged, and it cost the state more money in the end. Paid family leave is essential. It should not be optional to save money for the state, to save lives of those giving birth, and for the social and physical well-being of children during their critical development years. We would ask that you pass a paid family medical leave act.
I'm gonna say snaps, snaps, and more snaps. That was really good and very impactful and pretty clear. It just kind of drew you into that experience. I really appreciate you all sharing. I appreciate all of you sharing. And as we are exiting out, I want to bring us to a close, remind you, first of all, just thank you for going through this activity and exercise, you know, what was it like for you crafting a story? It's not as easy, right? It's not as easy, but I just, as you are exiting, thinking about, you know, this is something that you have as a tool and that you can refer to in your work, and as you are at elevating your advocacy presence, you do have the ability to make an impact. And so I just want to reiterate, just thank everyone for their time today, and refer you to Generate Health's website for both the advocacy tool. Check out the legislative report card, see and challenge and hold our elected officials accountable, and use that advocacy guide as, you know, to pick and choose some ideas for ways to do that. We are here to help, so reach out to us. I know my lovely counterpart, Sarah Kennedy, behind the scenes, would love you to complete the evaluation. And you will also receive a follow-up email requesting such, as well as the links to the tools. So thank you so much for your time today, and have a great Thursday.